Today marks World Mental Health Day, a day for global mental health education, awareness and advocacy against social stigma. 1 in 3 South African adults will experience mental illness in their lifetime. Now, today, the South African Society of Psychiatrists joins the global call by the World Health Organization and partner organizations to scale up investment to improve access to mental health as one of the most neglected areas of public health worldwide. They have also called on the government, SASOP, or rather, they called on the government and health authorities, rather, to increase training for mental health care workers and professionals and improve geographic distribution of mental health care facilities. But to tell us more on this, we are joined via Zoom by Dr Sebolelo Seape, who is a psychiatrist and president-elect of the South African Society of Psychiatrists. Dr Seape, a very good morning to you. Thank you for joining us. Welcome to Morning Live.
Good morning, and thank you for having us.
Now, mental health is one of the most neglected areas in healthcare. Why do you think that is the case, and what needs to be done to ensure that those affected are actually assisted?
Yeah, you're right. Mental health is the most neglected and the least budgeted for. I think this is just a tradition of governments not to have taken mental health as seriously as they should have and not allocate the amount that they should.
Now, with COVID-19 shaking up the world in recent months, what have you been able to monitor in terms of the number of people living with mental illness?
Well, with or without the COVID, I mean, globally, you have about 450 million people in the world who are affected by mental health conditions, which is a huge number. And of course, the COVID pandemic, as you're aware, has increased these numbers because most people, and usually not the people who have ever had mental health issues, now have got an inkling of a mental health condition, especially anxiety disorders have increased. The measures to try and hold down the numbers in COVID, which included social isolation and restriction, and of course the fact that we don't know enough about COVID, and people are living in constant fear of death and infection, has obviously increased the numbers tremendously.
What are some of the stigmas brought about by society when it comes to mental health issues? Do you get a sense that enough is being done to educate the public, or is there room for growth?
There's never enough education here. And of course, we all know that the stigma is so well and alive, and therefore that means it is not, people are not really understanding and getting to know what mental health is. What should be happening really is that mental health should become a normal everyday topic and should be discussed, and so that people get to know, they get to learn. There should be a concerted effort that teaches people about mental health, whether it is from the clinics or from the hospitals or even in schools, and so that people are more aware. We call it mental health literacy. People should be more literate about mental health, its effects and whom it affects and what to do when somebody has a mental health issue. But as it stands right now, we know that it is not talked, even in families where there is even people who are affected by conditions. It's not talked about, it is hidden, it is sort of a bad secret family thing. And it's very, very sad because it doesn't promote information, it doesn't promote knowledge, it doesn't promote development and growth. And of course, I think it has an impact on the fact that it also doesn't encourage government to spend better on mental health, because maybe also the statistics are maybe not great enough in most countries and definitely in our country to show how many people are affected. And the services are few and far between, both in urban and rural areas, and of course in rural areas it's a whole lot worse.
Now, Dr. Seape, you've called on the government to increase training for mental health care workers and professionals. So what are some of the things or issues needed to improve mental health service provision in South Africa?
Well, you have talked about the number of healthcare practitioners. They are almost, it's a very small number. I mean, in South Africa right now, we're standing at about 1,000 psychiatrists in the country. And that 1,000 actually includes people who are not working, it includes people who are retired, it includes people who are working in industry. So it's not 1,000 service providers to people. It is just 1,000 trained psychiatrists. So a population of 60 million, it is very, very little. And our ratio is at about 0.05 per 100,000. The accepted international standard is 1.5.
Wow.
Because if you get to countries like Switzerland, you have 12 per 100,000. So we are lagging terribly. In terms of training, it would be wonderful if government would increase the number of mental health workers or health workers that they're churning out, both in terms of giving, the right subsidies, and when it comes to specialists like psychiatrists, obviously, if the quotas would be increased, and the universities would also have an obligation to churn out a bit more.
Dr. Seape, those figures you just gave us are so alarming. I mean, 1,000 psychiatrists in a population of 60 million is very, very concerning. So what are the current stats then in terms of the amount of mental health care facilities that are available?
Well, I don't know the stats of the facilities that are available. And facilities, remember, it includes a wide range of facilities, whether it's hospitals, clinics, NGOs. So I don't have that stats, but we know that they are not enough for the population. In the urban areas, there's a bit more than in the rural areas. But then again, you can still say it's not enough, because in the urban areas, the population is much higher. So you'll find that in the community clinics, people are getting appointments, they're seeing the psychiatrist once every 6 months, which is sometimes not enough, in fact, often not enough.
Under normal circumstances, good mental health, Dr. Seape, is very crucial to the functioning of society. But then during a pandemic, it can affect how we respond and recover. How then do we go about responding to such?
Yeah, in the pandemic, I think, as you know, that the government made a concerted effort in terms of guiding us in terms of how to respond in the COVID-19 pandemic, the lockdown rules. But I think not enough was put into the mental health and the consequences, because COVID will go, I'm certain about that. Mm-hmm. It will end. Maybe in another 18 months, 2 years, there will be none. But unfortunately, the mental health consequences will last much, much longer. And I don't think we have prepared adequately or at all for that. People, anxiety disorders, depressions, and of course we know the economic hardship that has been brought on by the COVID. This is going to produce even more mental health issues, and we haven't prepared anything for that.
Yeah, and this stigma needs to stop, because it certainly is exacerbating the problem even further, Dr. Seape. But thank you so much for your time and the kind of work that you do in this regard.
Thank you so very much.
All right, that was Dr. Sebolelo Seape, who is a psychiatrist and president-elect of the South African Society of Psychiatrists. It is